So this is a video about discharging process in Cerner at Antelope Valley Hospital. So first you have to open the chart. This is a test patient, and go to provider view. You want to see a few tabs here. You may not have the discharge tabs, and if that is the case, you have to add, adding here discharge. So once you have that, you go to discharge. You want to see different items you will have to go through. Yours may be a little different order, different items here. So be aware of that. There are two things that you need to do. A very important thing you need to do. One is a discharge order, and the other one is a medication reconciliation. That has to be done all the time. There are several ways to do this. I normally do this discharge order and medication reconciliation from order outside of this workflow. But to simplify the process, you can go through these items. So one is so first thing I have here is in my view is discharge diagnosis. So you go through all this. If you did progress note properly, this will be already done right way. Otherwise, you have to either add the problem list, or you can change the priority of the existing diagnosis. So please do that. And I have to, if you go to medication reconciliation, you click on that. This is already done because it's test page. But if it's not done, you're gonna see this red dot over here. So you go to these items and you click here, discharge to home. You're gonna open the medication reconciliation window. So if you wanna continue them, so the left side is the medication the patient is currently getting in the hospital and the home medications. Before the admission will be on the left, and the right side is the medication the patient is gonna go home with. So first of all, you're gonna home medications that were not given in the hospital are here. So you can continue if you want to continue with that. So you go click on this one. The red is obviously stop. If you want to stop, if you want to write a prescription Cerner, you click on here. If you have this X, you have to go through that. So you click on that and you write the SIG here. You can write a duration. But we normally don't do prescription in Cerner because we do at the Health Connect, and it's a little bit not reliable, the prescription sent from AV Hospital to Kaiser, especially because it's going to one pharmacy only. Things like that weekend is a problem. So we normally don't write the prescription, and we put do not send to the other reason, and then we write the prescription at Health Connect. So this is the way. So if you want to continue, is here. If you want to stop, is here. And if you want to write a prescription or change the SIG, you have to click here, and you go from here and then change the. If you want to instead of taking 2 tabs at home, you want 3 tabs. So you do 3 tabs. 3 tab. Write the prescription. Okay. So duration you can write here. But the patient won't have the duration, some other instructions in her or his discharge instructions. So to write in his discharge instructions, you have to click on here. You write whatever you want. So take if you have edema, or something, take until for 3 days. So that will be printed in the discharge instruction. So you click on that and then describe it there. So you go through all these medications. So next one is the medication, home medication that we're continuing in the hospital. So this bunch of medication, you go through that, and lastly, the medication, new medication that we're given in the hospital will be here, and by default is stopped. But if you want to continue this new medication, you click on continue, or if you want to change the prescription, you click on here. So once you have done that, or if you want to write a new medication, you have to add here. And this is like any other prescriptions. I created a favorite here for hospice patients. So if you want, you can create, or you can write a new prescription here. Those are like when you're ordering inpatient medication. So the same thing. So once you have done that, you sign it, and medication reconciliation is done. And then next one I have here is follow-up. I have a bunch of templates here. The primary care I have already set up here. Otherwise, you can write the doctor's name. You can see Dr. Trong. You're gonna see here. So you click there, and you can write within 5 to 7 days. If you wanna save as a template, you can click here, or otherwise you can save here. It's gonna show up in the follow-up. You can write, free text. So for that, let's say hematology. As a free text, you have to go add hematology as a free text. It's gonna show so within 2 weeks, and save it. So it's gonna show up here. So this is a follow-up, but importantly, the case managers who set up these follow-ups, they don't normally see this in the real time. So you have to talk to the case manager or a texter, core texter about follow-ups. Otherwise, this may get lost. So that's the follow-up. And as I mentioned, you have to do discharge order. In my item here is where is the discharge order? I'll enter discharge order here. So you click here, and then this may be a little bit complicated, but it's in the home. There's a discharge folder here. You click again, discharge, and then you're gonna see that the cart here. So you have to click the cart and sign it. And you're gonna see different items in the discharge order phase 1. You have to do phase 1. Phase 2 are done by the nurse. So this is the phase 1. So 3 items you have to go through here. So one is discharge disposition, home with the family care, right click on diet, modify. Sorry about that. And the diet instruction, you can do a regular home diet, or you can change that. Right click on here, as instructed with a physical therapy. So this is physical activity, diet, and the discharge disposition. And the other one that I sometimes we use is the discharge timing. So you right click on here, so you can write some conditions, special instructions. Let's say that discharge after O2 is delivered, things like that. You can write that, but it's better to talk to the nurse anyway, because sometimes they don't see this. So order for signature, you sign it. I know it's a lot of clicks for one order. That's why I don't do this normally. I just go from order, set, and then I just add from here discharge, and I use here. But this may complicate the issue, so if you want to go through the items here, you can do that. So discharge order is done, follow-up is done, med break is done. And then just take the quick hospital course here. You may not see this kind of a layout. I like this layout because I have, when I dictate the hospital course, I can see, um, different items in the middle. So if you want this layout, you can do that clicking this. So it's this, when you click here, this goes to the left. So discharge, where is it? Hospital course again here. So if you want this one to appear on the right side, you click on here, and it's gonna be on the right side. So once you've done a hospital course, physical exam, you can write patient instruction like a wound care, or I have that phrase for sliding scales. I do a medium dose of sliding scale. Have a phrase for the sliding scale coverage for the patient. So this will be printed out for the patient. So you can write different kind of instructions here. So once you have done that, I think it's done. So you click discharge summary. And a few things you may need to add if you want. For the coding purposes, you can add the time spent for discharge, let's say 45 minutes, things like that. And then if you want to print or include the radiology results, you do .rad and click. You want to see this patient doesn't have any radiology, but if your patient had some imaging studies, that will be showing up here. So once you have done that, sign, submit as progress note, and sign it, and you're gonna and done for the discharge summary and discharge orders. Now, when the patient goes to the nursing home, we like to click on discharge instructions, because we wanted to print discharge instructions so the case manager can print it out and send to nursing home. So you can do that and then sign. You don't need to print. The case manager will print it and sign it. So it's going to show in Cerner chart. So the case manager can look at it and print and send to nursing home. Otherwise, discharge instruction will be printed by the floor nurse at the time of the patient is leaving. So that's too late for the case managers to send to nursing home. So these are the things that we do for nursing home patients. Because we do that because discharge instruction has a little more clear instructions about medications. So that's why we prefer to print discharge instructions. So I think I cover most of the items. I'm sorry that this has been too long. Thank you for your attention, and if you have any question, you can always reach me. And thank you for your help. I appreciate it.